why assholes need to get fucked, but don't. Because many med students and doctors and nurses and clinicians in general actually don't know how to assess sexual concerns or give accurate information about it. And this is an example. If you're new here, I'm Dr. Catalina, your psychologist training you to live a life led by pleasure. Not sure where you're at? Take my quiz and join my Substack. As a psychologist and my role as professor, I've trained thousands of healthcare providers, med students, PhD students in how to assess and address sexual well-being. Because unfortunately, many weren't taught. And all these biases and misinformation then actually get projected onto patients. And this is an example of how. Notice when we talk about anal sex, there's all of these health concerns. But you talk about vaginal sex and, are there no health concerns there? There's health concerns around almost every activity that we do, both in and out of the bedroom. And when it comes to sex, definitely. You know how hemorrhoids start? They start because you're constantly tight. And you're trying. That's why sometimes when you have a big bowel movement, you can get hemorrhoids then. Women, when they're pregnant, they also get hemorrhoids. But this comes from biases of thinking that it's bad and you should never do it. So then under that logic, one, how come 30 to 40% of the population reports doing it? But then how come we don't talk about pain and other things with other types of play? That's by design. There are definitely considerations when you're having any type of play, whether that be vaginal or anal intercourse. And there are STI considerations to protect yourself and be safe. And there are strategies to get your body to feel relaxed, communicate consensually. These are the core elements of what I call your pleasure quotient, your PQ. Similar to IQ and PQ, your pleasure quotient requires a foundation of safety so that you feel relaxed in your body so that you can actually experience pleasure. And then curiosity of figuring out how best what gives you pleasure, what do you actually like, and how best to support your body. And then begin to explore the sensations. And if you start to feel pain, then that's actually an indicator. But too often, people keep on pushing. And when we have pain in any type of receptive role, our body perceives each experience of pain as a new assault. To actually gain enthusiastic consent, foster that safe space, and then foster this connection. Whatever you're doing, whether that be butt play or something else.